Welcome to Doctors on Call. I'm Jenna Miller. Physical therapy involves treatments that focus on prevention and management of injuries or disabilities. Physical therapy helps to relieve pain, promote healing, and restore function and movement. Physical therapy, that's our topic today on Doctors on Call with our guest, physical therapist Troy Herrman and Ashley Moeder.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Grove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Troy Herrman is originally from Ensign, Kansas. He attended Fort Hays State University and graduated with a degree in biology. Troy then received his Master of Science degree in physical therapy from the University of Kansas Medical Center. After working in St. Francis, Scott City, and Hays, Troy created Herrman Physical Therapy and Wellness in 2017. Ashley Moeder grew up in Otis, Kansas. She attended Wichita State University and received a degree in exercise science and then completed a doctorate of physical therapy from WSU. After practicing at Rooks County Health Center in Plainville, Ashley joined the staff at Herrman Physical Therapy and Wellness in Hays. Give us a call at 1-800-337-4788 toll free with your questions about physical therapy today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or therapist. Let's go ahead and get started with some of our questions while we wait for those calls to come in. First of all, let's talk about why do patients need physical therapy?
There's a lot of reasons why patients could need physical therapy. One of the main reasons probably that I see is back pain. After surgery, any kind of knee pain, ankle sprains, even back surgery, or total knee replacements, total hip replacements, or just your common, pains. Maybe you can't turn your neck or things like that. Do you have anything else to add?
Yeah, basically when it affects your function too. You have all those different types of pain, and as long as your function's okay, a lot of people are willing to tolerate a little bit of pain, but when it starts affecting your function, maybe you can't reach in the cupboard anymore, maybe you can't tie your shoes anymore, or can't walk very long or stand very long, then that's a lot of times when people will seek out physical therapy. So.
How does one find a licensed physical therapist?
There's actually a really good way to find a licensed physical therapist. It's on our national website, American Physical Therapy Association. It's apta.org. And you can go to the menu there, and there's a selection where you can find a PT. And all you have to do is type in the zip code, and you can put however many miles surrounding your area, and it will show you all the available certified physical therapists on that site. I think if you actually type in find a PT on Google, you can find the APTA website on there also that has the find the physical therapist.
So there's a difference between somebody who's licensed and somebody who's not, but they can still do physical therapy? How does that work?
Well, all PTs are required to be licensed. Mm-hmm. So there are people out there that use the term physical therapy. They shouldn't, but every PT that practices in the state is considered a licensed physical therapist as long as they go through the credentialing process. You also have physical therapy assistants that work closely with the PT and kind of follow the plan of care that the PT sets up. Yeah, they also are credentialed as well.
If a patient sees you for the first time, what happens during that examination?
During the examination process, we'll kind of go through your medical history, and we'll be able to decide if there's any red flags, meaning there's some sort of medical attention needed. But we'll go through that, and then we'll talk about what kind of pain you're having, or what difficulties you're having, what is limiting your function, and then we kind of go through a screening process, seeing how well your strength is or your motion, things like that, and then we go through testing as well, depending on what body part that is limited in function. And then we usually give you some sort of exercises, or try to do some sort of treatment to help you feel better.
Well, there may be some patients who might be a little leery of coming because they might think it hurts. Tell us.
Well,
debunk that rumor.
Yeah, well, we'll debunk it. If any patients are watching, I'm sorry. Yeah, sometimes you know it hurts. But it's not always fun. It's not always easy because sometimes we're getting people to do things that they can't do on their own. They're not comfortable doing on their own. So there are instances where it can be uncomfortable. We work really hard to make our facility fun, make it uplifting, and communicate with the patient and say, okay, this is to your tolerance. We're not going to push you beyond your limits. You're going to be uncomfortable at times, but they tell us, and I have that conversation with every patient that I'm working with. I'm saying, hey, there's a limit, and you tell me where that limit is, and the magic word is stop, and I stop. And you try to make that clear with your patients because it is not always a real pleasant experience, but most people are willing to do that as long as they get the results that they want to get.
How long might a person need to receive physical therapy?
Oh, well, that can really vary. We go anywhere from maybe seeing a patient one visit because maybe you're setting up a home program, or I know one of the things Ashley likes to work on is your BPPV, which is the vertigo that people get sometimes. Sometimes that only takes one visit. Or you could have an individual that's maybe had a rotator cuff repair and they might be there 6 months. So very dependent upon the diagnosis that they're receiving and what all they have going on.
Okay, does physical therapy require a doctor referral?
No, it doesn't. It actually used to in Kansas when I started. Now, actually, I don't think you've never known PT.
Not for very long.
Yeah.
Yeah.
So
it was right about when I came out of school.
Okay. Yeah. So when I started a millennium ago, there was we did rely on a doctor's order always for physical therapy. Now all of your states have some sort of direct access where you can go in and you can see a physical therapist without having to have an order from a physician. So it's opened up the physical therapy world a lot.
Let's talk about the difference between physical therapy and chiropractic care.
Yeah, that's always...
Let you get that one.
That's always a challenging one. Physical therapists and chiropractors, we've constantly had this battle because we share so much common ground, right? We treat a lot of the same conditions, and so there's always kind of been a battle between our two groups. I actually, used to work with a couple of chiropractors, had a great relationship with them, had some good times there, and we worked well together. I think the main difference is chiropractors tend to focus a little more on the spine. They definitely focus more on manipulation as a form of treatment. Physical therapists, we focus more on the soft tissue structures, the strengthening aspect of things, getting individuals going with that home program for exercises. Not that a chiropractor couldn't, but I think a lot of them end up really busy with their schedule that's a challenge. We still do mobilizations to joints. We can do manipulations to joints. We don't do it at the frequency that your chiropractic world does as far as the manipulations are concerned.
Okay, very interesting. We're going to go to the phone lines now. We've got a caller waiting to ask a question. This is Shay on the line from Belleville. Hi, Shay. Go ahead with your question for our therapist tonight.
Hi, I have kind of two questions. My first is wondering if I need to be injured or recovering from surgery in order to receive physical therapy. And that leads me into my second question. I've heard some about dry needling, and I was just wondering if most physical therapists offer this, and if you could tell me a little bit more of that aspect.
Yeah. So for your first question, you are asking about the sorry, I already forgot your first question. This is not if you need to be injured. No, absolutely not. So as far as an injury or anything like that, no. If you're having neck pain or back pain or knee pain, or even if you're just having headaches, you can come in and talk to us, and we can let you know if you need to have therapy also. We actually at our clinic do free consultations just to kind of chat with you for maybe 10-15 minutes and see what's going on, and let you know if that's if something that physical therapy can help you with. And then for the second question about dry needling, Troy and I are not certified in dry needling. It's something that you have to take classes for, and you have to go and actually do that extending from your actual schooling. There are quite a few now that actually have that certification, but and there are a few around here, and it's a very great modality to have, and it really targets muscle tightness and things like that, but we aren't certified in that. However, like I said, it's a great modality to have, and it's not a bad thing to look into.
Okay, very interesting. We might talk a little bit more about that in a moment, but we've got another caller waiting to ask a question, so we'll go to the phone lines again. This is Stan from Great Bend. Hi, Stan, go ahead with your question.
Yeah, I've got a lady friend that's been in a wheelchair since she was in a fire a while back, and her legs ain't that mobility, and I'd like to know if she's trying to get into a walker, so I need to know if do you have to have a doctor's assistant all the time to get somebody in a walker?
I'm sorry, what was that question again?
He was asking.
You wouldn't have to have a doctor's order necessarily to get them from a wheelchair to a walker. You know, I'd encourage you to find a physical therapist that would be willing to look at her and kind of assess her. That's one of those challenging questions to answer on the air, but if you had a PT that had an opportunity to look at her and kind of give you their opinion on whether or not they thought she could get back to that point to be able to use a walker again versus a wheelchair, it's definitely worth a try, and I encourage you to do so.
Now, what range of age do you treat patients?
All ranges. I mean, from pediatrics all the way to, you know, as old as 90, 100 years old. There's a huge age range that we treat. Troy does most of the pediatrics at our clinic. I mean, small kids, but I take anybody from probably elementary school up to, like I said, 100 years old.
Mm-hmm. Excellent. And we were talking about the difference between chiropractic care and PT. Let's talk about maybe the difference between a trainer and a physical therapist.
Yeah, you've probably had more experience with that because you've got to work. It's been a few years, but I worked with trainers a while back. I'll let Ashley get that.
Yeah, we had an athletic trainer at our hospital, and the difference, she did a lot of the on-field game type acute injuries and things like that, and they are really, that's their best, you know, practice is on the field, game time, training types of things. And we focus on mostly the same types of rehab, and athletic trainers do some rehab with, you know, sports injuries and things like that. And so we focus on the same thing, but we do more of that, you know, further along care. So a lot of times, and we see acute care too, but a lot of times we'll see them further out, not just like right there on the field, whereas athletic trainers are right there. Is there anything you have to add to that?
Yeah, no, I think that's well put. They work on that acute on the field care that we don't get a whole lot of that in PT school. So yeah.
Now, can the benefits of physical therapy help to avoid some kinds of surgery?
Yes. I mean, there are all kinds of things coming out now in research saying, you know, that maybe we try some more conservative care versus going right away to surgery. They're looking at even knee replacements and things like that. There's a lot of people coming to therapy first, and honestly, with back pain patients and people even considering back surgery, I always say, give us a chance. Because sometimes there's just some tight muscles or even some limited strength around the joint or around the back area that is either not strong enough or too tight, and just by fixing that, some of your symptoms will go away. If you're having symptoms down your leg and things like that, we take care of that. And sometimes just that being gone, you can live with some of that more chronic pain, maybe more of like a 2 to a 4 type of pain versus an 8 or 9 when you have symptoms. So yeah, absolutely, give us a try at least. And I always tell people that are going to get knee replacements, you know, pre-surgery rehab will actually help in the long run, because if you can get your knee straightened out or bent to its max before you go to surgery, it's not going to be nearly as hard after you come out.
And strength too.
And strength too.
You can build that strength up.
Yep.
And I don't know about Ashley, but that's kind of one of the, I think, big victories for a lot of PTs. If you're working with somebody that's been told, hey, your only option is surgery, but they're not ready to do it, and they come to us and they say, hey, you know, I really don't want to do surgery. Do I have another option? You work with that patient, and they get to a point where they don't need surgery or are able to put it off for a few years. That's a huge victory, and that always feels pretty good.
Very good to know. All right, we're going to go back to the phone lines. We've got Gerald on the line from Great Bend. Hi, Gerald. Go ahead with your question for our therapist tonight.
I got a pain in my back, and I was wondering if it's muscle or my pelvis. I had an accident in 2013 and been hurting ever since.
What did you do when you were 13? What sort of accident did you have?
When I 2013.
2013.
I rolled it 4 times.
Yeah, again, really hard question to answer on the air. I encourage you to go find a physical therapist to visit with, let them do an assessment on you, and they'll be able to tell you. That's one of the things that PTs focus on. Okay, where is the pain coming from? Why are you having the pain that you're having? Is it muscular? Is it more with the joints? Do you have some rotation going on in your spine or in your pelvis? And through that first visit that we talked about earlier, you know, we can get a pretty good idea of what's going on in there and what we need to do to change that. So seek out a PT, visit with them, and hopefully they'll be able to help you out.
Okay, how important is physical therapy after surgery?
I'd say very important, and it also kind of depends on the surgery that you've had. Just like Troy was saying earlier with the rehab, how long do you usually attend physical therapy? Well, it's the same with surgeries. It can be, you know, maybe 2 weeks after, you know, a scope or a repair or something like that, but then you have ACL recoveries that can be up to 4 to 6 months. And so most of those surgeries, though, you're going to want to come see us at least for information on what exercises you can be doing and how to strengthen, because anytime you go into surgery, you're going to have some weakness most likely and some limited motion just because of stiffness from the procedure.
Now, can physical therapy shorten the length of recovery time?
I would say so. I mean, you know,
Absolutely.
there's, yeah.
In most cases, you know, I think you could say that because what is your recovery time determined by? It's determined by when is your function back, when is your range of motion back, when is your strength back. So PT, which that's what we focus on, if you get those things back quicker, obviously your recovery time is shorter and you have better function quicker.
How long does a session typically last with a patient?
With us, I would say anywhere from 30 minutes to an hour. A lot of times it ends up, you know, 45 minutes to an hour. Hands-on wise, I would say probably 30 minutes at least of hands-on, you one-on-one with your therapist.
And about how many times a week?
It varies.
Sure.
I hate that answer, but it depends.
No,
you know, it just depends on where you're at. And, you know, sometimes I have people that they do their exercises every day, they do them correctly. I only have to see them once a week because they go home and do the rest themselves. And then, you know, there's others that need that little bit of push along and help to do the exercises correctly. Maybe they're not strong enough to do yet at home what I'm helping them do in the clinic. So, you know, those people maybe 3 times a week. And so it just kind of varies.
So if a patient is able, how important is it to go home and do the exercises on your own as well?
Huge.
Very.
You know, ask any therapist, and probably our biggest challenge is, okay, we give you these exercises because we know it's going to be beneficial for you. You've got to continue with them at home. And even that's the best thing to do to keep from having to come back to see us once you're discharged. You know, we try to give everybody exercises to do, and we want them to continue with those. So it is vital. Going to a PT twice a week isn't going to be enough if the exercises are really going to help you. You've got to be faithful at home too.
So if a person maybe at home doesn't need physical therapy, but they need, I'm assuming you're advocates of exercise and exercising in general.
Yes.
How often, how long a day, each day should a person be exercising?
I think right now it's saying, what, 150 minutes of exercise is kind of the standard, and that's per week. As far as that's concerned, that's cardiovascular. That's, you know, some sort of exercise, get your heart rate up a little bit, and I think that's
the term it moderate activity, which you know 4 days a week at like 40 to 45 minutes. Activity, and that doesn't mean it's like, okay, I'm going to the gym and exercising for this time, but you know, you're walking around in your yard, mowing the grass, are you shoveling, are you doing those type of things? You know, that's what they want us to get away from, that sedentary lifestyle that really is the most expensive thing to all of us, which can lead to obesity. So
So mowing the lawn counts then?
Absolutely. It's activity. Now, as long as you're not sitting on your riding mower. You got to be pushing or walking or just something like that.
Okay, we're going to go back to the phone lines. We've got Connie on the line from Russell. Hi, Connie, go ahead with your question.
Hi, thanks for taking my call. Yes, I was wondering if physical therapy was beneficial for an elderly person with osteoarthritis. Thank you.
Absolutely. I know Troy's going to agree with me. Just like I was saying before, sometimes the pain in that joint can be helped through strengthening the muscles and stretching the muscles around it. And sometimes just that extra activity that we just talked about, getting the fluids going, getting the blood pumping, things like that is also really helpful for arthritis. If you have anything more to add to that, but my answer is absolutely.
And weight-bearing activity, strengthening through the muscles increases the bone density, bone mass, and that as well, which you want to make sure that's something that's included. And it can be very beneficial.
Okay, back to the phone lines we go. This is Joel from Goodland. Go ahead, Joel, with your question.
Yeah, you visited some about physical therapy from surgeries. What's your take on physical therapy and like this new stem cell work that they're doing on folks?
Yeah, have you had some? I've had several that have had the stem cell, and a lot of times the doctors do order physical therapy with that. It's vital because you still are trying to improve the range of motion of the joint. You're trying to improve the strength of the tissues. So if you just give the stem cells, you're not going to get the results that you want. That's basically to give your body the tools so that you can go on and achieve that healing process. Did I say that well? I mean,
and I think a lot of people that are searching for that stem cell type of stuff, they've been having pain for a while, and so when you've been having pain that long, there's probably been adjustments that your body has made to compensate for that pain, and so therefore you're going to need some, again, strengthening in the muscles that are supposed to be working instead of the ones, you know, that you've been compensating with. And so I think that's really important too.
Now, I know we've talked a little bit about the pain, but what kind of pain might a person be having that they realize, okay, this is not normal and it's happening every day, that they might need to come see you guys?
That's a good question. Yeah, you know, pain can be a lot of different things. I think it doesn't hurt to go check us out. You know, and other places I know offer the same thing, but one of the things we do, I know Ashley mentioned it earlier, if there's something you have a question about, you're concerned about, you know, we offer free consults. You can come in, all it costs you is your time. Come in, let us do an assessment on you, see where you're at, see if we can figure out what's causing the pain. If we think, hey, you know, this is not even musculoskeletal, maybe you need to be seeing your medical doctor. So we make, you know, referrals with that as well, because sometimes people just need somebody to to check it out. And I don't know, I feel like there are times where people are more comfortable visiting with us than maybe visiting with their medical doctor as well. But if it's something that's more serious, you know, we can get them where they need to be.
You know, I smile and when you ask that question, because if you're having pain, that's your body telling you that something's probably not right. So any type of pain is really my answer to that question. If you're having any type of pain, then you probably need to get it looked at. I mean, there's always that, you know, oh, I have a little bit of an ache somewhere, or, you know, and you think, okay, I'm going to get through it. Well, when it turns into pain and, you know, something that's eliminating function, then you need to just come see someone, at least it'd be your doctor or us, and do that free consult. Somebody needs to see it if it's that debilitating.
Okay, well, our thanks goes to Troy Herrman and Ashley Moeder for being our guests on tonight's Doctors on Call. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Cove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
10 seconds. Russell Regional Hospital. Experts, neighbors, friends.